Welcome to Tech Talks, everyone. My name is Jane Osler, and I'm the project manager for the NPRP assessment at the EMSE Data Center. And today I'm going to be taking you through the 2026 NPRP assessment from Click to Gap Report. I'm going to give this training to ED clinicians, and since this session is being recorded for educational purposes, we are going to hold all questions until the end, but please feel free to put them in the chat, and if there's time, I will try to answer them live or respond to you offline. I want to provide you with just some quick background. The National Pediatric Readiness Project, or NPRP, is an initiative to empower all emergency departments to provide effective emergency care to children. The project is led by the federally funded Emergency Medical Services for Children program in partnership with support from multidisciplinary organizations. The project was conceived in the 1990s by Dr. Marianne Gaucher-Hill from LA County and her colleagues, who were concerned about growing gaps in the care of children in emergency departments. This led to the establishment of a first set of guidelines for the care of children in the ED in 2001, and a pediatric readiness assessment for emergency departments was created in 2003. The goal was to help establish a baseline of where EDs were at with pediatric readiness and identify gaps so that they could make improvements. Those early benchmarks led to a new set of guidelines that informed a new assessment in 2013, and the pattern continued with new guidelines in 2018 that informed the 2021 assessment. A newly updated joint policy statement was just released this week from the leading experts in emergency medicine, emergency nursing, pediatrics, and surgical trauma, and it outlines the essential actions every emergency department must take to deliver safe, effective care for children. These new guidelines help to inform the new 2026 Pediatric Readiness Assessment, and we are incredibly grateful to emergency departments nationwide who have shared this journey with us to help improve care for kids. So, why should an emergency department take the assessment? The support of ED leadership, physicians, and nurses is so important to help benchmark against updated national standards. It also allows us to track progress over time, in this case, progress at the national level and ED level since 2021, and it helps us to identify new gaps and opportunities for improvement. It contributes to research and policy efforts that save children's lives, and it also benefits hospitals who are seeking verification or facility recognition, as many national organizations now are adopting the assessment and pediatric readiness into their standards. Assessing pediatric readiness is important for EDs to address any gaps they might have with things like pediatric care coordination, physician and nurse training, quality improvement and performance improvement plans, family-centered care policies, equipment, and so much more. These are the necessary components of high-quality emergency care. And we know that high pediatric readiness in EDs is associated with up to 76% lower mortality risk in children. And if all EDs met these standards, research suggests that over 2,100 children's lives could be saved each year. So how does an emergency department participate in the upcoming assessment when it launches on March 3rd? Well, I'm going to take you through it step by step. Just please note that since we will be transitioning to the new assessment, what I show you today is in a test environment. That means that any data that is shown here is a mock-up for demonstration and not the actual results of any hospital or emergency department. I also want you to be aware that since the 2026 assessment has not launched yet, most of what you see will be snapshots of the assessment and the gap report rather than going through all of the questions one by one. So first, you're going to want to visit the assessment website at pedsready.org and download a PDF version of the assessment. The instructions will be on the left-hand side and will give you the option to download it in English or in Spanish. Just note that this PDF version is for review purposes only, and to receive a gap report, you must take the assessment online. Since an ED can only take the assessment once during the national period, it's a good idea to review the PDF version first with your ED leadership. Gather your responses to the questions and then choose someone to take it online at pedsready.org. So we strongly recommend that you choose someone who works on site at the ED, who has knowledge of daily operations, that is someone who can pull open a drawer in like a crash cart and find a piece of pediatric equipment. This might be someone who's familiar with policies or someone who oversees pediatric care coordination at the ED. You know your teams best, and we're here to support you and answer questions all along the way. When you're ready to take the assessment online, you can click on the red Let's Get Started button to begin. And I'm going to go there now to show you how to find your hospital or ED. So I'm going to off-road it here for just a second. We have the Pediatric Readiness Project assessment homepage. This is what's currently visible when you visit pedsready.org. This is the open assessment website. This is what happens after a national assessment is we have an open assessment period. So we capture the nation at a very specific point in time, and then afterwards we reopen the assessment so that people can continue their quality improvement journey. They can take the assessment multiple times, identify gaps, and then work together toward improvement. So right now you can see it says download and print a copy of the NPRP assessment. This reflects the 2021 assessment. So I'm going to jump over to a test site right here that shows you what it will look like for 2026 when this one launches in March. You'll see some instructions here, shows you where you can download the English or Spanish version of the assessment. And then again, we have this great big Let's Get Started button in red here. So I'm going to go ahead and click on that. And what opens up is you're going to see for your state or territory, you'll see a box here that wants you to select your specific state or territory. So here we have a drop-down menu. I'm just going to scroll down to Utah, and I'm going to select Utah. And then you'll also see on the right-hand side here some information. If you have any questions about the assessment, you can contact our PedsReady support team. If you want more information about the project, you can go to pediatricreadiness.org, and it will give you more information about that. So those resources are available to you here before you get started. Or if you're ready to proceed, you can go ahead and click on the Get Started button. And then it asks you to select your county. So from the drop-down menu again, I'm going to go ahead and select Salt Lake. And then I'm going to click on Next. And you'll see what pops up is a listing of hospitals in Salt Lake County in Utah. And all of these inside the page here are hospitals. I'm going to scroll over Primary Children's Hospital. And you'll notice that when I scroll over, it kind of grays out a little bit. This just means you're going to select it. But if you were to take the assessment and it's complete for your ED, you've submitted it, what will happen is if you go back to this portal, this hospital will be grayed out because that means someone has already taken the assessment for that ED. So if you prepare for it and you come in here and it's grayed out, that just means someone else from your facility has already taken it. That's why coordinating with your ED leadership is so important to see who will take it for your ED. So I'm going to go ahead and click on Primary Children's. A final page appears that shows this box that wants you to verify your state, your territory. You can see that's correct, the hospital name right there. And then what you would do is click on Start the Assessment. Now, I'm not going to do that here because, again, we're in a test environment. I'm actually going to go back to the presentation here so that I can show you the welcome page that appears on screen. Okay, so this is the welcome page. It provides information about the goal of the NPRP initiative, and it reminds you to save the gap report you're going to receive at the end of the assessment. It talks about how long the assessment might take, so about 30 to 45 minutes with some preparation, but it also lets you know that you can save your progress and come back to it if needed. Finally, it discusses confidentiality and who you can contact if you have questions. The next screen will ask for your name and your title, and then move on to additional guidance. This is just a reminder that your ED is going to benefit most by having someone who works on site to take the assessment. And since only one assessment can be taken per ED during the national period, we want to make sure that folks are aware that you cannot modify any answers after it has been submitted. There are a lot of trauma centers that take the NPRP assessment for ACS center verification too. So if your title includes trauma, an extra paragraph is going to appear to remind you to just check with your ED leadership so that two different people aren't attempting to take the assessment for the same ED. We also encourage you to share results with each other. So it's just a collaborative effort. Moving on to examples of other questions. Sometimes you're going to see a red asterisk by the question number. This indicates that this is a required question. To qualify to take the assessment, your ED must be open 24/7. So if it's not, and you click on no, the assessment will end at this point. If you'd answered yes, then it's going to proceed to the next question. And I'm going to go ahead and skip ahead over some demographic questions and show you the different sections or domains of the assessment. Before I do, I just want you to also notice at the bottom of the page that you can save and exit or go back or click on next to move ahead to the next question. So if at any point in time you need to stop the assessment, we know how busy ED clinicians are. So of course you're going to, maybe need to stop and come back to it. You can click on the save and exit button and a new screen is going to appear. This details the save and exit process. And it's as simple as just entering your email address on the line on the left. And then you click on send email reminder at the bottom. And then you can click on the finish button after that. This is going to save your assessment right at the spot you left off so that you're ready to come back, or when you're ready to come back, you can just check your email, navigate to the link that it provides you, and then it will take you back to your place in the assessment. So save and exit is a really great process and a nice feature to have. So again, there are 6 sections or domains of the assessment. You can see up here at the top, it says administration and coordination for the care of children. This first section is going to ask questions about physician and nurse pediatric emergency care coordinators, or what we often refer to as pediatric champion. They're also known as PECs. And you can see that the questions continue under this section. Skipping ahead. The next section is physicians, nurses, and other healthcare providers who staff the ED. The question you see on the screen is specifically about nurses, but there are questions about physicians and others as well that ask about credentialing and continuing education. The questions in the next section cover quality improvement and performance improvement in the ED. This question, like several others on the assessment, may show some notes or examples to provide additional context to the question. So you may also notice that sometimes if you click on either yes or no, it will skip you ahead to an entirely new section based on your answer. So for example, if you answered no to this question, to question 43, your next question could be 49 instead of 44 in a normal sequence if you had otherwise said yes. So on the bottom right, you can also see the next button that appears on most every page. The fourth section of the assessment covers questions about guidelines for improving pediatric patient safety in the ED. Things like weighing children in kilograms, how vital signs are monitored, pre-calculated drug dosing for children, and level of pain are examples of these types of patient safety questions. And going forward, the 5th section covers the guidelines for policies, procedures, and protocols for the ED. You can see above this section heading as well where it provides some additional context to the questions in this section. And you're going to be seeing things like policy questions about triage, pediatric patient assessment and reassessment, child maltreatment, disaster, and interfacility transfer policies, just to name a few. This 6th and final section asks questions about equipment, supplies, and medications for the care of pediatric patients in the ED. And again, the note above indicates specifically that we want to know about how equipment and supplies for children are stored and resupplied. One of the final questions on the assessment asks if you would like to receive free resources and opportunities that can help you improve pediatric readiness at your emergency department. This looks like just 4 to 6 emails annually from the EMSC program. And these may be different from emails you already received from your state EMSC program. So feel free to choose yes or no on that. We know that physicians and nurses are incredibly busy and wear so many different hats in the work that they do. But the good news is that we have done a lot of the work for you and have created evidence-based education, tools, collaboratives, and networks to guide you every step of the way on your journey to pediatric readiness. So before you submit your responses, this page will appear on your screen. It reminds you that in order to get your gap report, you do need to click on the Finish button on the bottom right-hand side of the page. You also need to save this gap report once it appears, and we encourage you to share the results with your ED leadership so that you can coordinate pediatric readiness and align with quality and performance improvement efforts. You're also going to receive an email with a code to reprint your gap report if you need to. So again, if you click on the Finish button, a gap report is going to appear. But before we do that, I just want to show you a test version of the email, what that looks like when it gets sent. So we're incredibly grateful, so grateful for participation from our EDs. And at the top, it acknowledges the completion of the assessment for your hospital. And it comes with, it asks you to save the email, and then it comes with a link to a package of really cool completion materials. It includes a certificate and social media templates so that you can give a shout out to your ED for participating online. It also encourages others in your network to participate too. There's also a link to resources from our NPRP ED toolkit to help you in improvement efforts. And if you need to reprint your gap report, you can click on this link and copy and paste the code below. Right now, the code has been redacted because this is a test email, but it will be there for you to copy and paste after you click on the link. So this is what that email looks like, and we're so excited to provide this functionality for folks. So you've gone through all the questions, you've entered in your responses, you've clicked on Finish, then this window will appear, and now you can see your gap report. So right now I'm going to transition to a PDF test copy of the gap report so that you can see what is inside.
We have a quick question. Will state and territory contacts be able to access the gap reports during the live assessment or only afterwards? If they lose it, they'll get the initial one, obviously, but will they be able to get another one during the assessment or only after?
Yeah, that's a great question. That's a great question. So per the assessment, we know that as part of the welcome page, it talks about how only your state and territory EMSC program managers and the NPRP project will have access to the results. So during the data collection period, yes, you will have access to those gap reports. The gap report itself is sent only to the respondent. So that email is only sent to them based on the information that they provided in there. So I hope that answers that question. Yes.
And then if they want it, if the user wants it, they would just have to contact the manager, correct?
Yes,
yes,
but if they have, the link, we've sent them the link to their email, they should be able to access it with that code that I just mentioned. So great question. Great question. So this is what a gap report looks like. Excuse me. You can see it's been redacted because, again, this is test. This is a mock-up just to kind of show you what we're looking at here. We have your hospital ED name. Again, this goes to the respondent, the volume that you selected for your hospital, and the state name. We also have the current assessment date, just to make sure it's who you are right there. You've got email address and phone number. And then because this is within your organization, it will show you the previous assessment date, the respondent name, and their contact information because it's inside the organization. Again, this just talks about saving the PDF, just making sure that you have your report. And down below, you'll notice your hospital ED pediatric readiness score and comparison scores. So the red box on the left there shows the score that you got for taking the current assessment, so for 2026. The next box over is your site's previous assessment score. So this could be the score from the assessment that you took in 2021. Or if you took it after 2021 during the open assessment period, it will reflect the most recent time you previously took it. And then you'll also see the national average score of all participating sites. So this will be dynamic during the national data collection period. As soon as more medium volume sites participate, if you chose medium volume for your hospital, you'll also see comparison to hospitals of similar volume nationwide once more participate. So there will be a fourth box there as well. Moving over to the page on the right, you've got an analysis of questions in the assessment by section. And I just barely went over those sections with you, so they should look familiar. You'll see we have a legend down here that shows whether or not an item was met, a pediatric readiness item was met with a green check mark, or a red hyphen if it's not been met. At the top, you have this section heading, and then you can also see the section score. You'll also notice here that there are several columns. You have the previous column, which indicates the previous time you took it. So this is comparison scoring to the previous time the ED took it. Then you have the current scores. That's currently reflecting the most recent time, so the 2026 assessment, and then the points possible. So here you can see they have a physician and a nurse coordinator, which is awesome. And then we move on to the next section. So we have physicians, nurses, and other healthcare providers who staff the ED. You can see that 10 points were possible, and this particular ED got 7.5 out of 10. You'll notice in the columns for the previous section that there's an NA right here. What that means is that in the previous assessment for 2021, this question was not asked, but it is asked in the current 2026 assessment. So if you see an NA there, that's just what that means, that it wasn't asked. And it looks like this particular assessment shows that they did not have continuing education requirements. If you see that, what will pop up underneath this section is a statement. It'll say, you indicated your ED does not have something. It could be a piece of equipment. It could be continuing education requirements. It's just a notification. It'll say underneath of that why it's important to have that particular item. So for this one specifically, this one doesn't have continuing education requirements in pediatric emergency nursing clinical care. The importance of that is that obtaining and maintaining continuing education in pediatric emergency nursing equips nurses with essential knowledge to recognize and treat life-threatening pediatric conditions and ensures the maintenance of critical psychomotor skills using pediatric equipment. So these are just great reminders and helps to know where you can maybe look at gaps and start making improvements. So we have this section, we have guidelines for QI and PI in the ED that we covered previously. We have guidelines for improving pediatric patient safety in the ED. Just go along. This is a beautiful but long report. We've got guidelines for policies and procedures, and this is incredibly detailed information, which is great for scoring right here. You can see use of validated pediatric triage tool. Again, that wasn't asked in 2021, but it was asked in 2026. And then we have a very, very large equipment section. You can see where those important statements are popping up to help you out. Equipment and supplies. You can see exactly where you can target your efforts. You'll notice on the equipment and supplies section that there's one important statement, and then it shows underneath of it which ones are missing. So it's flipped just a little bit there for equipment just because there's so many items, but they are incredibly important. The resources that I mentioned above at the top of the GAP report are also really important. I just kind of want to show you what those pages look like as well. This is our NPRP homepage about the project. It also gives you information about the assessment, and it shows you where you can access our ED checklist and ED toolkit for resources and information to help you prepare for the 2026 assessment. We also have selected publications up here that show you the most recent guidance that was just released this week in the Joint Policy Statement. We have a spread the word page if you're interested in helping to spread the word about pediatric readiness or that the assessment is coming. There's lots of talking points and information there, including a frequently asked questions page. And then if you have additional questions, you can also contact the National Pediatric Readiness Project for more information. So I just wanted to show you that right there. Going to pop out as well from here and show you just a reminder. We are having a webinar that's coming up really soon. And we're super excited for this webinar to be hosted by our co-leads of our project. They are going to be providing some fantastic information about the new guidelines. They're going to be sharing information about the 2026 assessment and also about the life-saving potential and low cost of pediatric readiness. So this is Dr. Marianne Gaucher-Hill, Dr. Kate Remick, and Dr. Hillary Hughes who are going to provide this information. You can scan the QR code on the screen. And I'll also provide the link to that page at the end so that you can access that and register. We encourage you to invite just as many ED clinicians, including nurses, physicians, and administrators, to participate with you. So finally, here are what people have said about the assessment. This is comments we've received from the 2021 assessment. Some folks are unaware of the need for these policies and they learn something from the assessment when they take it. People say that they need to work on pediatric readiness, which is something we're all here for. Thank you for allowing us to be a part of your survey. Grateful for suggestions and support. We know that folks have unique challenges. You know, you're critical access hospital, but they can still be prepared for ages, all ages across the lifespan. Smaller facilities take the assessment, but they're always striving to meet national guidelines for patient care. So pediatric readiness is a national imperative and achievable. So whether you work at a large children's hospital or a rural critical access hospital, we know that pediatric readiness is a journey and we are here to help. So I just want to thank everyone for your participation today, and especially for all you're doing to support pediatric readiness at your ED. If you have any questions, please feel free to email our Peds Ready support team at the email listed on your screen. And you can visit pediatricreadiness.org for more information and free resources. Looks